Hey guys, this is going to be our last review that we have over Chapter 10 and 11 for your Lecture Exam 4. Some of you have probably already taken it, but if you are reading the announcements, which some folks still are not reading the announcements, and we're almost done here, I posted a chart for you that I give the students every semester. I call it the chart, but it's on the nervous system, and it's going to be very, very helpful on this exam. In fact, it's going to take a lot of the Chapter 11 with it. Also, I will be giving the 20 points for those of you that complete the class. Some of you have gone AWOL on me, or some of you have gotten offended by something and decided apparently not to finish out your coursework. So I can't really help that. This is unprecedented time. If you've changed your hours, I've had no choice but to put some of the lab exams on at a certain time and have people take them. Otherwise, we have no integrity to the course. It still doesn't prevent people from having a book right out in front of them. But we're doing the best we can, and I'm sure you guys are too. So let's get this review in, and we'll try to post it as soon as we can. So this will be next week. Chapter 10. Okay, this is Nervous System 1. I'm going to go through this fairly quickly. That slide should look very familiar to you from Chapter 5 of last semester. We talked about the neuron, the dendrites, everything coming into this area, the cell body, and then the axon leaving. One part we want you to know is that information goes from dendrite to cell body to axon. Sorry, I'm going to back up here a minute. One thing we didn't talk about at that time were the neuroglial cells, or what we simply call neuroglia or glial cells. And you can see this was not on your slide in the Chapter 5. There might have been a couple of those, but we're going to define what those are here in a moment. This chapter actually kind of goes backwards. We start at a certain point and then we go backwards. All right, the divisions of the nervous system, normally I would write these out on the board in the lecture. We're not testing you on these divisions per se. We're testing you on things in the divisions. But if we divide the nervous system into two parts, you have central nervous system, peripheral nervous system. Central nervous system is the brain and the spinal cord only. Peripheral nervous system are the cranial nerves and spinal nerves, what are emerging from the central nervous system structures. We can divide this. The peripheral nervous system has divisions. We have a sensory division and a motor division. Sensory division, we'll talk more about that in Chapter 12 next semester. It's more about the sensory receptors. The motor division is what supplies your muscles and glands, either skeletal, smooth, cardiac, or gland. We divide this into two parts, somatic and autonomic. Somatic has to do with skeletal muscle only. Autonomic, or what I like to call automatic, is smooth muscle, cardiac muscle, and gland supply. Then we can further divide the autonomic. I guess they didn't show that. Let me go back here. Apparently they don't show that, but we'll show it right here. No, they don't. We can further divide the autonomic nervous system into a sympathetic and parasympathetic division. And the sympathetic division we call the fight or flight, and the parasympathetic division is concerned with homeostasis. We'll talk a little bit more about that later. I'm going through this very rapidly because there's a lot here, and again, these things take hours to get on there. General functions of the nervous system, that's something good to know. We have a sensory function, integrative, motor. So in other words, if I hit my thumb with a hammer, that's going to create a sensory impulse. That sensory impulse is going to come back to the brain and go, ouch, right? That's the integration. Then it's going to go out and it's probably going to say, move your thumb out of the way. That is the motor function. So those are the general functions. We're going to give you specific functions for specific parts. That's primarily what your chart is that I put on Blackboard already. Again, information goes through the neuron from the dendrite to the cell body to the axon. Now, you've seen me draw a neuron which early in the semester which looked like the sun with a tail. Here's their version. Here's something I didn't put on, these little white packets on here. What that is a myelin coating. Myelin is a fat coating that increases the transmission of the neuron. It makes the impulse go faster. I'm going to move forward here. Okay, how does that myelin get on here? There are two cells we're going to talk about here in just a moment that actually are responsible for putting myelin on the neurons of either the central nervous system or the peripheral nervous system. But if you see myelin on an axon, that is what makes white matter white. You've probably heard of white matter or gray matter in the brain or the cord. White matter is on the inside of the brain. I think I showed you that in the lab review. It's in the outside of the cord. Gray matter is on the outside of the brain, on the inside of the cord. Gray matter are cell bodies and dendrites. This portion, which it has no myelin on it, it looks gray. This will look white. MS. This is not on your test, but just real quick, MS is probably one of the best clinical applications in the text. MS is a demyelinating condition, meaning that it's destroying the myelin on your neurons, and the neurons are not propagating like they should. I actually had two patients that I diagnosed with this in my clinic over the years. All right, classification of neurons and neuroglial cells. I'm going to combine these together. We have a structural classification or anatomical classification, and we have the functional classification, or I guess you could call it the physiological classification. Bipolar, unipolar, multipolar is the anatomical classification. What does that mean? This is a multipolar. This is how we will talk about the neuron throughout the chapter. All these poles, you count them, 1, 2, 3, 4, 5, 6, going into or out of the cell body. There's 6, that is multipolar. Here it has 1, 2, that is bipolar. Here it has 1, that is unipolar. However, we can cross-classify these. Some of these are sensory, some are interneurons, some are motor neurons. Sensory neurons take things to the brain of the spinal cord. Interneurons link the sensory to the motor. So once you integrate something in the brain, that interneuron will take that signal to the motor neuron and make a change. Again, if I hit my thumb, sensory neuron will carry that to the brain. It will be integrated, interpreted. The interneuron will tell the motor neuron, move your thumb, stupid, basically. So that's how it works. Okay, we're back to the beginning when we saw the neuron with all those little dots around it we call neuroglial cells. We're going to define a couple of those. This one is in the peripheral nervous system. In other words, the cranial nerves and the spinal nerves. The Schwann cell is what puts that myelin or fat coating on the neuron. And again, that's in the peripheral nervous system. In the central nervous system, I'm going to show you number 3 first. The oligodendrocyte is what puts myelin on those neurons in the central nervous system. So in the brain and the cord, when you see a neuron, it is myelinating that neuron. Microglial cells are the garbage man of the nervous system, and I would know it that way for the test. They eat things, eat the debris. They are phagocyte. Astrocytes, these are all important functions of the astrocyte, but I want you to know it helps to form the blood-brain barrier. Probably talked about my mother having a stroke in class. This is what was disrupted in her brain. It's actually part of the blood-brain barrier called the blood-cerebrospinal fluid barrier. Ependymal cells, and I will use that term, ependymal with the L. These are going to line ventricles in the brain. It's something that I don't think we went over on your lab test, so when I'm grading that, if we have a question on the ventricles, I'll just give it to you on the test, because I don't think I ended up going over those. So there's some things on each test I'm giving you, whether you know it or not, because I just didn't have a chance to cover it. But they line the ventricles and they help to move what we call cerebrospinal fluid. Cerebrospinal fluid, or CSF. That is a fluid that's within the brain and outside the brain, and within the cord and outside the cord, and these help to move that. Alright, we're going to skip on over here. Skip that altogether, that's not even true. Alright, the synapse, I think we started covering this in chapter 9. Your last exam, 7, 8, and 9, chapter 9 was the muscular system. We talked about how the neuron, the motor neuron, supplies the muscle. We went over things like neurotransmitter, motor end plate, neuromuscular junction. Well, at that time we talked about the synapse, which is a space between, at that time, the motor neuron and the muscle. We also have synapses between neurons. Neurons can synapse with neurons or join together, and we're showing that here, but they don't ever actually touch. There's a space there. So we still have that chemical that has to be released, that neurotransmitter, to bridge that gap. And again, neurotransmitters is what was released. This is a good blown up picture of that. Remember, we covered this with this being the muscle. Here we're talking about a nerve. And in this case, you can see all these, if you can see this, it's very small, positive and negative charges. What actually happens is we change the voltage of this structure, which is probably our next, this is our next thing we're going to talk about. Once you follow me out to the whiteboard, we're going to go mobile here, and my wife's going to follow me out to the whiteboard, so you may see all kinds of things here. You're filming, right? Mm-hmm. Okay. All right, I got to find some pens here. Neurophysiology is what ends this chapter, and I want to try to make this short and sweet. Basically, this is going to be the cell membrane of the neuron right here. Here's another neuron. We just talked about a synapse. Now, when we talked about this with the muscle...
There's a glare, it's covered.
Okay, there's a big glare on the screen here. Let me turn the lights on. How's that? No good? All right, let's just do this. Okay. Let's just do that. The entire rest of chapter 10, we got a glare out here in the garage. The entire remaining part of chapter 10, here's what I want you to know. Sodium comes into the neuron and causes something called depolarization. It changes the charge from a negative to a positive. Then potassium goes out of the cell, causing repolarization, bringing it back to what we call resting membrane potential. Just focus on that. We don't have a very good whiteboard scenario here. Too much glare in the garage. So we're going to go back in and do chapter 11. So let's go back in. Okay, sorry about the grand tour there. I thought that whiteboard would work out better. But just remember those 2 points on the test. So, Merry Christmas, as I say sometimes in the class. That'll help on that. Now, chapter 11. There's some points in here that are not covered on the chart. But the chart is going to summarize a lot of chapter 11. So I'm going to streamline this real quick. This starts out just going through the divisions of the nervous system, which we already did. Central nervous system, the brain and the cord. Well, we didn't talk about the meninges. The meninges are connective tissue layers that cover the brain and the spinal cord, and they protect it. The dura mater, which in Latin means tough mother, it's very tough, is the outermost layer. It actually, in the brain, it actually adheres to the inner part of the skull. It doesn't do that in the spinal cord. The arachnoid mater is the next layer that's adhered to the dura mater, and it is actually refers to a spider, spider-like. So, and the reason it does, beneath the arachnoid mater, and it's not in your notes, we have something called the subarachnoid space. Actually it is, it says it right here. Space contains cerebrospinal fluid. That's where you find this fluid flowing. You're going to see the brain is actually floated, kind of floated inside the skull. It has fluid on the inside, it has fluid on the outside. The last layer is the pia mater, and it's adhered to the brain surface itself, and it means delicate. And it attaches to the brain and cord itself. Now, we have this also, there's a picture of the meninges on the brain and here where they've been cut off. So your brain has a cover. When you have meningitis, this is what that is an inflammation of, if you've ever heard of that. A lot of pictures here that you guys don't have. You don't need to know those. Now, when we go to the spinal cord, there's a big difference here. The dura mater, which this is a much better picture, is the white layer. The arachnoid is the light purple. Then you see blue, that is the fluid, the cerebrospinal fluid, and then you see red, that is the pia mater, which is adhered right to the surface of the brain and cord. Big difference here, the dura mater does not connect to the bone in the vertebra. So it does, but it doesn't connect directly to it. It has little ligaments called denticulate ligaments which reach out and attach. But because it doesn't attach, that sets up what we call an epidural space, and any of you that have had a baby are likely familiar with that space or what they do in that space. They shoot some medicine in there so it will diffuse into the cord and numb the nerve endings all the way down. All right, let's go on here. All right, the ventricles of the brain. This is the part that I'll give you these answers on the lab exam, because I know there were some in there and you guys have no clue what those would be, I'm sure. So I'll give you those on the lab exam because we just didn't go over them in the lab review. But if you can see, this is a excuse me, anterior view of the brain. We are looking through the brain. Here are what we call the lateral ventricles, which are sometimes called ventricle 1 and 2. Ventricle 1 on the right, ventricle 2 on the left. These have cerebrospinal fluid in it. And I didn't say that earlier, but cerebrospinal fluid gives nutrition to the brain. It's basically blood plasma. So it gives nutrition, but in this case it also protects it. We just saw in that subarachnoid space the fluid is surrounding the brain and the cord. Now it's inside the brain and the cord. So it's really, kind of floating, protecting, and giving nutrition to the brain. So here's how this flows, and this is what I want you to know for the test. It goes from the lateral ventricles through something called the foramen of Monro, M-O-N-R-O. Your book calls it the interventricular foramen. I will call it the foramen of Monro. Then it flows into the third ventricle. From the third ventricle, it flows through the cerebral aqueduct of Sylvius, or just the cerebral aqueduct, into the fourth ventricle. And then the fourth ventricle just simply narrows and goes down into the spinal cord as the central spinal canal, which was on your lab test, the little dot in the center of the spinal cord. So just know that flow through the brain. What actually happens is you have two openings in the fourth ventricle, and that allows it to get up into the subarachnoid space in the meninges. So it's pretty cool. Nice pictures here of some of the ventricles. I actually saw this as a little aside. I saw this in a student showed me a picture of this of her daughters, and it looked like she was missing the right ventricles. They were so closed down, and she was told to abort this child, and she told the doctor to buzz off and had the child, and the little girl was an honor student, and all she had was a little tiny bit of seizure activity. So, and I saw pictures of her, cute little kids. So, sometimes you just gotta stick it to the man and tell them you don't believe what they're saying, because they want to give you the worst case scenario there. Again, cerebrospinal fluid, there's not a lot of it, about 120 mils, but it is clear fluid. I get tickled here. It says similar to blood plasma. It is blood plasma, essentially. It may not have the same components, but if any of you have ever had a lumbar tap done, this is what they're drawing out to check things on that fluid. All right, let's go on here. Let's go on. All right, the spinal cord. Spinal cord begins at the foramen magnum. You'll remember that from chapter 7 in the bones. And it terminates at the disc space between L1 and L2. We call that the L1, L2 disc. When we talk about an intervertebral disc, it is named for the vertebra above and below because it shares them. And that's very important there. It doesn't go all the way down your spine. It doesn't go down to the sacrum. It ends here. I have seen MRIs that said, the Conus Medullaris, which we call it, get to that slide here. There's the different regions of the spine. Whoops. Here's the term. Conus Medullaris, this is the cone-shaped end of the spinal cord, so that should end at L1, L2 disc. Occasionally an MRI will say it ends at the L2, L3 disc because someone's spinal cord's a little longer. It's just a normal variation. If it ends there, we have nerves that come off at each side of this. On each side we have a spinal nerve formed. In fact, did I just pass that? No, I didn't. And So if it ends here, these spinal nerves still have to get all the way down to the coccyx level. We have one set of coccyx nerves, and how they do this, and this is a really bad representation, they come off there like little hairs, and they find their holes, the right holes. That's actually called the cauda equina. That's something good to know. And cauda equina means the tail of the horse in Latin, a horse's tail. And I've seen it. I've seen dissected out. Your spinal cord's about the size of your thumb, but then you get down here and you got these little hair-like, looks like a ponytail coming off. It's one of the most amazing things I've ever seen. Okay, here is similar to the spinal cord cross-section we had for your lab, but this is based on a real one. So, we don't really need to know those structures anymore. But if you see here is the spinal cord. You can see the dark orange is the gray matter, the light orange is the white matter. Or here we see the gray matter, there's the white matter. And this is the dorsal root, ventral root, remember, forms the spinal nerve. Just giving you a little update there. All right, functions of the spinal cord. I don't always put these on there. Remember I did a demonstration, I think, or a little talk with you about the spinal reflexes, and how to grade those. That's where these come from, but this is what carries things to and from the brain. They call it a conduit, and if you know what a conduit is, it's a piece of pipe that an electrical wire goes through. And that's a great description of the spinal cord, because basically you have things either going up or coming down through that conduit. Okay, what a reflex arc is, and I would rather show you this on, I should have a film here. I guess the film's not going to show up here. Okay, sorry, I'm going backwards and forwards here, but here are the components of a reflex arc. Sensory receptor, sensory neuron, interneuron, motor neuron, and effector organ. So again, if I hit, there should be a video here of this. See if we can find the video. It's not, the videos aren't coming through on my PowerPoints for some reason. Okay, but let's just say it right here. Here's a part of your skin. The first thing was a sensory receptor, and I accidentally put my finger down on a pin, a tack. So that part of the skin has a sensory receptor, and it's going to send an impulse of pain, basically, back over a sensory neuron into the dorsal horn, and your spinal cord is going to say, ouch, right? It's going to tell the interneuron, which is the third leg, to tell the motor neuron to probably flex your arm and pull that away from the object you're sticking. That is called the withdrawal reflex. And believe it or not, you actually withdraw your finger before your brain is ever aware that you were in trouble. Now the cord, because that stays at the spinal cord level. Now I like to ask this in lecture, and this, I don't want to make this any longer than it has to be, but I always ask students, who told your body that that was a painful stimulus? In other words, if I put my finger down on a nice soft cushy pillow, am I going to withdraw it? No. So who told your finger that that was painful? I believe the great engineer did, and that's why I don't believe that the tree outside is your brother. We were created. And that's all I'll say about that. Let's go on here. Skip a couple. I went over the reflexes, some of the reflexes. We talked about the use of reflexes in the lab. You won't be tested on that. Now, the tracts of the spinal cord are very, very interesting. I am not going to make you know all these. I promise you. I want to point out a couple of names of these. Those of you that like the doctor shows, which most of them are soap operas, but if they do medicine on those shows, it is correct. And you may see them bring somebody into the ER, for example, and they're unresponsive, and they'll take a blunt instrument, like this tuning fork, the end of this, and they will stroke it on the bottom of the foot. And that person their foot should crinkle like that if they are over the age of 1.5 years. That is called Babinski's test. If they do that and the toes flare, that person's probably in major trouble. They have a major injury involving this tract. It's called the lateral corticospinal tract. And again, I don't want you to memorize that, but cortico means cortex. That's cortex of the brain, if you remember. down to the spinal cord. So that means it's coming down. So a descending tract is a motor tract. It's taking something from the brain out down to the cord and out to the body to do something motor. If it has the opposite, such as this, the spinothalamic tracts. Remember the thalamus of the brain. It is a sensory relay area. If it comes from the spine up to the thalamus, it is going up. That is a sensory tract. Those actually carry pain to your brain, pain sensation. What I want you to know, is right here on this slide. Ascending tracts are sensory, descending tracts are motor. Just know that. And we're going to skip the rest of that about the tracts. Okay, now we are to the brain. It would be good. See where it says functions of the brain? You are not going to study that here because you have the chart. The chart gives you specific functions for specific parts of the brain. If you didn't catch the last review, that will encompass 30 to 35%, if not more, of your last exam. That's a lot. But I would know the 4 major parts here. That's a great tailor-made multiple choice question. A lot of pictures, a lot of good pictures. You'll notice on the chart, I just want to mention this here. I said earlier, I think that when I did the lab review, that the cerebellum looked like the pages of a book, but the cerebrum looked like a bunch of noodles kind of laid in there. Well, what this sets up is a series of hills called a gyrus and depressions called a sulcus. And there's 2 of those that are on your chart that you do not have to match with anything. I want you to know what it. For example, the Precentral Gyrus is a hill. On this view, you'll see something called the central sulcus. It's a depression going right down through there. In front of that, we have a hill, and we have a hill behind it. The front hill is the Precentral Gyrus, and you'll see that listed under frontal lobe because that's where it's at. This is frontal lobe, and that is your primary motor area. So what you'll actually match something with is primary motor area with the frontal lobe, not Precentral Gyrus. But I wanted to show you those 2 hills for a reason. Behind the central sulcus is the postcentral gyrus. That is the primary sensory, or I think on your chart I say the primary somatosensory, we refer to it as, area. So I wanted to make a point here. We have a hill behind and a hill in front. This is primary sensory. So if you do something in your body that's sensory, it's going to be interpreted ultimately right there on that little strip. Everything. And then it's going to make the change by telling this strip to make a change. That's very efficient. Again, these people that think we evolved from a salamander, you can't get that specificity and that efficiency by chance. I'm sorry. Somebody had to engineer that. So let's go on here. Great pictures in here. You guys don't have those, I don't think. There's a Corpus Callosum. You've already been tested on that in the lab. Good picture of the hills, the gyrus, gyri, plural, and the sulci, the valleys. Again, the lobes, we cover those, the frontal, the parietal, the occipital, the temporal. And one thing we didn't cover in the lab is if you peel back the temporal lobe, there's a little more cerebrum inside there, and that's what is called the insula. That's actually on your chart. Sometimes called the Isle of Ryle. This says Island of Ryle. We call it the Isle of Ryle. It's more catchy. But it's a little part behind the temporal lobe, and I like to tease students and tell you guys you have a very well-developed insula, and you'll know why if you look at your chart, because I'm not going over that whole chart. So I'm going backwards here, sorry. Let's go forwards here. Okay, you're not going to study the functions of the cerebrum here. Do not study that. Study your chart. It's all on the chart, what I want you to know. So here is what starts the information for the chart. And I'm going to show you where it ends. That will replace all of these PowerPoints and even some more. Oh, one thing about, I do want to mention about hemisphere dominance. They're saying that what we used to know about that's not true, but this still is true. If you have an insult to the right side of your brain, such as a stroke or something, it's going to affect your left side of your body and vice versa. So you should know that. But we're going to keep going, keep going, keep going, keep going. I just don't have time to go over the chart, so I typed it up for you. It tells you what area of the brain is responsible for what function. Now, one thing on the chart, I'm not sure if this is real clear, where it says limbic system. The limbic system has a function all its own, and it's our center of emotion. And then beneath the limbic system on that chart, you'll notice it says the amygdala, which is part of this system, but the amygdala has to do with long-term memory. So let's go on here. So all the way up, this is still chart. The chart is replacing all this. A lot of this is just pictures. Sorry, my computer's not keeping up with me here. All the way up to here. So the chart, all that information on the chart, we skipped all those slides up to peripheral nervous system. And I'm going to need to speed this up a little bit. Again, peripheral nervous system are the cranial nerves and the spinal nerves. So let's look at these. The spinal nerve this is the definition. Write this down. Remember this for the test. Spinal nerves are the union of the dorsal root and the ventral root. You saw that in the lab. That is the spinal nerve. So the dorsal root has sensory coming in. The ventral root has motor going out. This is why we call these mixed nerves for the most part. Your book will say the first pair of spinal nerves are not mixed, and that is true, but we're just going to say they're all mixed for the test. The cranial nerves are on the bottom of the brain, starting here with the olfactory bulb and olfactory nerve. That's cranial nerve 1, called again olfactory, and then number 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. They are paired side to side. We have one on each side. We went over that lab on how to test for those, and here we're going to talk about the function really quickly. All right, this is not a great picture, but I think we had this in the muscle chapter. A single muscle fiber was covered by endomysium. A single nerve fiber is covered by endoneurium. A group of nerve fibers, guess what? It's called a fascicle, just like it was in the muscle. What covers a fascicle of nerve fibers is perineurium. And then if you put a bunch of those fascicles together, it forms the entire nerve, and that is covered by epineurium. So same prefix, just different suffix and different tissue. We have no nerve that approaches, well, maybe approaches some of the smaller muscles, but most of the muscles are way, way bigger than a nerve. All right, again, sensory nerves take something to the brain, motor nerves take something away from it. Spinal nerves are mixed. All spinal nerves are mixed. Don't worry about that first pair. That is true, but we're not worried about it. Skip this, way above our pay grade. Okay, cranial nerves. I'm going to go through this very quickly. Cranial nerve 1, sense of smell. That is the function. It is the olfactory nerve. You need to know the nerve name, the Roman numeral 1, and its function on each one. The name, the Roman numeral, its function. Cranial nerve 2, optic, vision. Cranial nerve 3, cranial nerve 4, cranial nerve 6. All have the same function, and they move the eyeball. There are some other things they do, but I want you to know that. They move the eyeball. Cranial nerve 3, olfactory or oculomotor. Cranial nerve 4, trochlear. Cranial nerve 6, the abducens, all move the eyeball. Cranial nerve 5 is what we call a mixed cranial nerve. Not all cranial nerves are mixed. Some are sensory, some are motor, some are mixed. You will not really have to know that for this test. So it has both motor and sensory, and I want you to know both. Trigeminal nerve. It is sensory to the face. It is motor to the chewing muscles. So chewing and sensory to the face. So any sensation you feel in the face, this is what will basically send that to the brain. Whoops, sorry, I skipped one. Okay, again, cranial nerve 6, we already did the abducens. It moves the eye with cranial nerve 3 and 4. So I will ask you those all together. Cranial nerve 7, another mixed nerve. It is motor to the face. If you smile, that's what is controlling that. And it is also the taste on the anterior 2/3 of your tongue. So motor to the face, sensory to the anterior 2/3 of the tongue for taste. Okay, cranial nerve 8, vestibulocochlear nerve. This will branch into two different parts, a vestibular branch and a cochlear branch. The vestibular branch has to do with equilibrium and balance. The cochlear branch, hearing, both sensory. Glossopharyngeal nerve. It's a mixed nerve. We're just going to say it's motor to the throat, and it's sensory to the posterior 1/3 of the tongue for taste. Motor to the throat and sensory to the posterior 1/3 of the tongue for taste. Now, I can't really tell you about this like I could in lecture. In fact, I hope you read up on this really well. But the vagus nerve, instead of all this doing, look at this picture right here. It doesn't make a whole lot of sense, but you see nerve branches going to all kinds of things: the lungs, the heart, the stomach, the spleen, the pancreas, the liver, the kidney, the throat, and then some of them going up into the brain. One word: parasympathetic. I mentioned it earlier. It's one of the divisions of the autonomic nervous system, which is a motor branch of the peripheral nervous system. This controls most of the parasympathetic supply to your body. So when your heart is racing, your body is going to cause parasympathetic supply to the heart to slow it down. It's a calming side of it. But this is a major supplier of parasympathetic supply. That's what I want you to know about it. Cranial nerve 11, the accessory nerve, actually supplies your trapezius muscle and your sternocleidomastoid muscle. Those were muscles on your lab test. So you can have we had someone shrug their shoulders against resistance. If they can't do that on one side, they have a problem with this nerve. Again, motor to the trapezius. Final hypoglossal, cranial nerve 12, motor to the tongue. So you can have them stick their tongue out. We did that in our demo lab. Okay, let's go on. Sorry to be going so quick, but we just don't have time to fool around. Spinal nerves, again, we're going to say they're all mixed nerves. You need to know the definition of the spinal nerve, which is on, on this slide. Union of the ventral and the dorsal root. Now, I need to back up one. A dermatome. Know the definition of this. Primarily know C1 does not have a dermatome associated with it. This is dermatomal maps. You can look at this map and it'll show you what nerve root controls a certain area of skin or sends sensory information back about a certain area of skin. The only one that doesn't have a dermatome is C1 because it's only motor. It's not sensory. But I use these all the time in my clinic to see where somebody had a problem. But just know C1 does not have one. All right, to go on here. All right, what a nerve plexus is once the spinal nerve comes out, let's see how I can do this. If the spinal nerve is my arm, it branches into, and two of my fingers are a branch, it branches into a posterior and anterior branch. The posterior branch goes to the back of the body and supplies the muscles, skin, etc. The anterior branch, some of those will join with other anterior branches, maybe 3 or 4 of them, and form a named nerve. That is called a nerve plexus when it does that. There are 3 nerve plexuses in your book, and what I'm going to give you is the plexus, one nerve in the plexus, and something significant about that nerve. You do not have to know the ranges because these are wrong. That should be C1 to C5 anyway. Because the nerve I'm going to give you, the cervical plexus, C3, C4, C5 form the Phrenic Nerve. So the anterior branches of C3, C4, and C5 join together to form what we call the Phrenic Nerve, and it supplies the diaphragm. That's what I want you to know. I'll show you a cool picture here. Here is C3, C4, C5 spinal nerve. Here is C3, C4, C5 anterior branch that form the Phrenic Nerve. Pretty cool. All right, the brachial plexus, which comes out under your armpit, kind of like that. This is why you don't lean on crutches when you have them. You can actually damage your brachial plexus. This forms a ton of nerves. And I'll just show you real quick some of these. The musculocutaneous nerve is up in here. The ulnar, the median, the radial, the axillary, This is where these supply. The one I want you to know is the median nerve, and the median nerve is the one involved with carpal tunnel syndrome, and that is in the brachial plexus. Here is part of the brachial plexus. It'll come out in your axillary region. So again, don't lean on crutches. That's not why that pad is there. Lastly, this is actually two plexuses, or plexuses, I think is the way you say it. We learned them as two. They're saying it as one, which is fine. You actually have a lumbar and a sacral plexus. But the lumbosacral plexus, I want you to know the sciatic nerve. Most people have heard of that as the longest, largest nerve in the body. Okay, let's go on. We're almost done. All right, in fact, this is the last thing. The autonomic nervous system, and again, I would encourage you to go look at the divisions of the nervous system. Don't memorize them for the test, but look at the central nervous system, then look at the peripheral. The peripheral branches into a sensory and a motor. The motor branches into a somatic and autonomic. Somatic controls skeletal muscle. Autonomic controls smooth muscle, cardiac muscle, glands. Then the autonomic branches into a sympathetic and a parasympathetic division. Sympathetic is your fight or flight. It speeds up. Parasympathetic slows down. It's for homeostasis. What I want you to know is the effect of these on 4 different parts of the body. Also, if you get a chance sometime, look up a Merrick chart. M-E-R-R-I-C-K, a Merrick chart. A Merrick chart is very interesting in that it will tell you what these nerves, these spinal nerves, what they ultimately will supply in your body. This is what I did as a profession for 13 years. It tells you what effect you can have on what body part. So, what I want you to do is compare and contrast these. If one speeds up, the other slows down. Think of the sympathetic, the fight or flight, as if you are running from a lion, a vicious lion, not your pet lion. Parasympathetic is the one that's calm and will slow you down. So if I'm running from a lion, what happens to, do you think I need to see more or less out of my eyeball if I'm running from a lion? You need to see more. So it will actually dilate your pupil. The parasympathetic will do the opposite. It will constrict your pupil. The heart. Sympathetic, if I'm running from a lion, my heart rate's going to go up, my blood pressure's going to go up. Parasympathetic, it will go down. Do the opposite. What else? Digestion. Do I need to poop when I'm running from a lion? No, I do not. If I do, I'm going to get eaten. So it actually inhibits the sympathetic nervous system. It will, or the sympathetic nervous system, let me rephrase that, inhibits digestion because you don't want the end stage of that. Parasympathetic will stimulate it. And just a little side note, if you're on allergy medicine this time of year, it can actually cause you to be constipated because allergy medicine mimics the sympathetic nervous system, which will decrease digestion. Last one, let me think. What do we got here? The heart, the pupil, the digestion. What else? What else? I'm forgetting one here. An awful. The respiratory system. Sorry. Respiratory system, the lungs. If I'm running from a lion, how big do you think my bronchioles need to be? That big where you can't see it, or that big? So it will dilate your bronchioles so you get more air into the lung. The parasympathetics will constrict your bronchioles. If you have asthma and you have an inhaler, it is called a sympathomimetic drug because it's going to mimic the sympathetic nervous system and dilate your bronchioles so you don't die. All right, that is it for that chapter. There's a lot of other stuff in here, but that was pretty much the end of the review. Again, good luck with that test. I tried to shorten that as much as I could. It's still a pretty difficult test, but remember the chart, 30 to 40% of the test will come off that chart, so study it. And thank you. Bye.